Good morning, Nat.
Good morning, Dr. Uswansa. How are you?
I'm doing well. How about you?
I'm fine, thank you. Even though I'm a little heartbroken that you didn't come to the studio, I would have loved to see you.
The weekend, you know, Monday morning sometimes is a bit hectic at the clinic.
Yeah, I can imagine. Okay.
So I started working early this morning, and I couldn't have left the
Yes,
kitchen. I'm
I
so
can
sorry that.
imagine. But it's still good to have you.
Good to have you too. How's your weekend?
My weekend was a bit slow. It was just slow, but I was good. It was good.
Thank God you're alive and you're back.
Yes, thank God. Thank God. All right, so let's get straight into it. Chronic fatigue syndrome. We started the series last week, and before you came on, I was telling my listeners about one of the things that stood out to me when we had a conversation about chronic fatigue syndrome was typhoid fever and the fact that because treating typhoid is a bit tricky and the bacteria can hide, it makes it very difficult, and especially if anything else, any other illness surfaces in your body and your immune system pays attention to that illness and leaves typhoid fever, the bacteria of typhoid, unattended, then it resurfaces, and then obviously all of that adds up to why you feel so tired all the time. Now, that and many others you spoke about when we had the conversation. So let's continue from where we left off.
So you were mentioning some of the conditions or some of the medical conditions that could lead to chronic fatigue syndrome.
Right.
I mentioned earlier that this condition is actually, it's coming because of certain diseases that you are not paying attention. So it's a condition. Chronic fatigue syndrome is a condition. However, if you are able to identify what is actually causing that syndrome or that condition, then you might be able to get out of it. So some of the diseases that people don't normally pay attention to is also urinary tract infection. Urinary tract infection, sometimes we write this into UTI. UTI. And the UTI, we have two categories. You have the upper urinary tract infection and then the lower urinary tract infection. So the upper urinary tract infections, that's where the infections will actually hide in your kidney, and then it causes pyonephritis. Pyonephritis. And Natalia, if you remember your etymology very well, I told you the 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 languages that we use in our practice are kind of Greek and Latin. So when you hear any word pi, it means fever. So paresia, paretic, all those things, it means fever. That's your body temperature goes so high
Mm,
than the normal level of the 36.5 degrees Celsius.
okay.
Yeah. So when you hear pyelonephritis, it means that there's an infection in your kidney, and then it causes fever. That is the first clinical symptom, fever. And because most of our people here in Ghana feel that every fever comes as a result of malaria. That they feel that when I'm having high temperature, when I am having sickness in when I'm having a bit weakness in my body, then it's the malaria fever. Yes, it could be something more life-threatening than what you're. Even though malaria fever is also life-threatening, but it could be something more to that of what you are thinking. So, pyelonephritis is an inflammation in your nephron, that is your kidney. And if you begin to treat these conditions, I mean, recurrently or concurrently all the time, you having pyelonephritis, it could actually affect the parenchyma of the kidney, and it may lead to CKD, that's the chronic kidney diseases. And this chronic kidney diseases will also let you feel so weak. You become so febrile, you become so malaise, and you might not be able to identify the cause. So, pyelonephritis as a result of upper urinary tract infection. That's one of the diseases that will lead to chronic fatigue syndrome. So when it comes down to the lower urinary tract infection, that one also affects your urinary tract system, like the bladder and then the urethra. That is a bit uncomfortable because you may feel burning sensations in your urethra. That's where you pass the urine. You might be feeling some itches, and sometimes men will see some watery or slimy discharges before they pass urine. They see that this thing can't fall, then it becomes frequent urination and burning sensations like that. However, because affected with the genitals, they are able to probably seek help early, and then that one will notice becomes a bit better. Another thing is when the infection gets to the prostate gland, when the infection travels to the prostate gland, then it causes prostatitis. So again, there are two types of prostatitis: the specific prostatitis and then unspecific prostatitis. So prostatitis is inflammation in the prostate. But then when it becomes specific, it means it could be the bacteria causing the urinary tract infection, which is the E. coli. It could also go to the prostate gland to go and cause inflammation, and then it causes painful ejaculation, and also it will cause something CPP, that's the chronic pelvic pain. So your pain will become chronic, and then it may lead to chronic fatigue syndrome, because chronic fatigue syndrome comes with pain, fever, headaches, and sometimes general malaise. So if you're a man who is going through all this in the CCP, which is the chronic pain, pelvic pain, you might lose interest in even having sexual intercourse with your partner. Yeah. So basically, these are some of the few diseases. There are many. So as we move on, then we will be drawing our listeners' attention to some of the diseases that, if they are not paying attention to, will actually conjoin to cause a lot of this fatigue in their system.
All right, thank you, Doc. So tell me, if for anyone who is experiencing this, I mean, it may not, in their minds, it may not be chronic yet, but just the general feeling of weakness suddenly and the disinterest in doing the regular things they would do, what would you recommend they do?
All right. So you said from the beginning that the chronic fatigue syndrome, it's a kind of tiredness, pain, and then numbness, malaise that has lasted from 3 months to 6 months. So that if you have been dealing with such things for close to 6 months, then it has become chronic. However, if you're experiencing these things now and you haven't gotten to that period yet, you could still seek for a medical help. I said again that chronic fatigue syndrome must be diagnosed. It must be diagnosed in the hospital setup. We can't be buying medications from probably a chemical shop or from the pharmacist or the herba. This morning, the first patient I got, the diabetic patient, and for 3 years he's been diabetic. According to history, but she has no idea that she's having diabetes. Can you imagine that?
Wow, that's...
Yes. She's a diabetic for 3 years. All the indications shows that she's a diabetic, yet she hasn't gone to hospital. Yesterday that she's coming, and the sugar level is so high, 14 point, I think I have a folder, 14.4 millimoles per liter. And then we did the glycated hemoglobin is also 9.1, which is very high. She's anemic. Urine is having so much of pot cells, epithelial cells. So, and they said, the husband said they've been, going from herbal hospital to another herbal hospital, and all they are doing is just herbal because they feel that, okay, what they are going through or what she's going through, herbal medicine could deal with it.
Wow.
Yes, but yet they don't have the diagnosis, they understand.
Right.
So, Fatigue syndrome must be diagnosed from a proper hospital setup. When you get to then you could deal with it bit by bit or one by one, and you'll be out of.
Okay. All right, Doc. Thank you very much for giving us more knowledge every day when it comes to our health. Tell us though how we can locate you for anyone who's tuned in, how they can reach you.
Right. So if you're listening to me and you're going through any health challenges, don't stay home. Don't try to be doing self-medication. It's dangerous. We keep saying this all the time, and it's not me alone. Other health practitioners coming to the radio media tell people that, self-medication could be very dangerous. It could be detrimental to your health. So if you're listening to me and you want to reach me on any disease, any condition that's going to call me on 0243 768 216. 0243 768 216. And then my clinic is located at Kanishi Main or Doko Road, after the market. If you're coming from Steko, after the market, this is where the Metro Mass buses. The Metro Mass buses have been painted with the orange color, so they are just in front of my clinic. We are just on the very serene area. You come here and then we'll have our labs here. We do the labs, and sometimes we do comparison of the labs because we're dealing with machines. So if you have some results which needs to be cross-checked, we do that. We work with Metropolis, we work with MDS Lancet, and I work with S7 also. So you go there to cross-check your labs, and then you come. We do more of alternative medicine, about 70% of alternative medicine. When I say alternative medicine, is a plant-based medicine. My medicines are tablets and capsules form. So people feel, it is normal orthodox. No, they are not chemical. They are Ayurvedic plant-based, and then root back, and then made up from powders, and then we formulated them in tablets and capsules form. There are no side effects of it. However, you have to go through some rudiments before you can take them. You can't just call me. Because now, something, people have been calling to say, I want to buy this medicine, I want to buy. No, we don't sell medicine. It's a clinic.
Okay.
And without going through proper laboratory or proper history taking to come out with a diagnosis, I don't sell medicine to patients.
Right. Okay. Okay. All right, Doc. Thank you. Thank you so much for your time, and have a good Monday. I wish you, as much as you're working, I hope that you're able to break for lunch and enjoy the rest of your day.
I've already had a good breakfast already, vegetables with bread and some juice. So I'm okay for the morning.
Okay. All right. Enjoy the rest of your day, Doc.
Thank you. So I'll see you on Thursday.
Yes, please. All right. Okay, so there you have it, Dr. Owusu Ansah. Still continuing.